Hi, it's Patrick Hutzel from IntensiveCareHotline.com, where we instantly improve the lives for families of critically ill patients in intensive care so that you can make informed decisions, have peace of mind, real power, real control, and so that you can influence decision making fast, even if you're not a doctor or a nurse in intensive care. This is another episode of Your Questions Answered, and in last week's episode I answered another question from one of our readers, and the question last week was, how can I stop the ICU team from being negative of my mom's condition? Help. You can check out last week's question by clicking on the link below this video. In this week's episode of Your Questions Answered, I want to answer questions from one of my clients, Bong, as part of my one-on-one consulting and advocacy service. Bong's mum is in ICU, and Bong is asking why the ICU team intends to remove his mum's breathing tube and disconnect her from the ventilator to die. So today's question is, why does the ICU team intend to remove my mum's breathing tube and disconnect her from the ventilator to die? Hi Bong, and today's episode is a continuation from last week's question from Bong. So, hi Bong, as I have looked upon how the ICU is managing your mum's current condition, I agree that they might have an interest in ending your mum's life, and I've seen it over and over again after I have worked in intensive care for over 20 years in 3 different countries, and where I have also been a nurse manager for over 5 years in intensive care. Intensive care teams, generally speaking, are overtly negative. They often paint a doom and gloom picture for families in intensive care. And if you don't know how to challenge that, if you don't know how to ask the right questions, it's very difficult for you to get the outcomes that you want. Because if anything is going to happen in intensive care, the teams with their negativity and their doom and gloom often want to shorten treatment and want to simply withdraw life support so they can free up an intensive care bed and focus on the next patient that might have a higher chance of recovery or make them more money. Also, can you please send through some pictures of ventilator, bedside monitor, arterial blood gas results, chest x-ray results to begin with? We need to have this information gathered, list of current medications, ideally some blood results as well. Bong writes back, hi Patrick, I see the pictures online showing chest physiotherapy where they massage the patient's back. The therapists do nothing like that, and I have watched them for the past few weeks, twice a day. The therapist just runs the machine testing only for spontaneous breathing trials. See the hospital's weaning procedure. They set the machine and leave the room for hours. The only therapists are the respiratory therapists. They could care less if mum is awake or asleep. They prefer to leave mum in a drugged stupor 24/7. They do not care if she's laying down or sitting up. There are a few experienced therapists like the one who ran mum at 8 pressure support. I would not be surprised if she has been disciplined for doing so. Each therapist does just what the doctor ordered. They know nothing about weaning procedures. They are trained by the hospital. Young trainees accompany them. If the hospital protocols do not list it, they are not doing it. You may want to see hospitals' training manuals. Hospitals will be no different than any other hospital here in our place. The report has ventilator data. They set those values and leave. They look for pressure support, which is 10 during testing, PEEP, tidal volume, oxygen, and failure to breathe. Instead of a picture of the ventilator screen, how about I ask for a printout of all settings since the start? If there is something else you want to know, let's see what they're doing or not doing at resting periods and during the trial periods. Kind regards from Bong. Hi Bong, as for your current email, please see details below. Number 1, I see the pictures online showing chest physiotherapy where they massage the patient's back. The therapists do nothing like that, and I have watched them for the past week twice a day. The therapist just runs the machine testing only for spontaneous breathing trials. See the hospital weaning procedure. They set the machine and leave the room for hours. The only therapists are the respiratory therapists. They couldn't care less if mum is awake or asleep. They prefer to leave mum in a drugged stupor 24/7. They do not care if she's laying down or sitting up. One of the best ways to improve your mom's breathing effort is through chest physiotherapy. If this is ordered by the doctor, depending on the hospital protocol, the respiratory therapist or the ICU nurse even should be religiously doing this and needs to be properly documented as well with their clinical assessment of your mom's pre-CPT and post-CPT. If they're doing procedures like for the spontaneous breathing trial, your mom needs to be strictly monitored for good assessment. With the condition of your mom, she needs to have occupational therapy and physical therapy for rehabilitation starting this time for support, and you can request it to them, and they should be explaining to you their reasons for not being able to perform it. Number 2, you're saying, today the ICU will have the reports like you have already received showing everything. Do you want older reports? Yes, if you could provide me with older reports, that would be great. I want to see your mom's progress from the start and what led to the failed spontaneous breathing trials. Number 3, there are a few experienced therapists like the one who ran Mum at 8 pressure support. I would not be surprised if she has been disciplined for doing so. Each therapist does just what the doctor ordered. They know nothing about weaning procedures. They are trained by the hospital. Young trainees accompany them. If the hospital protocols don't list it, they're not doing it. You may want to see hospital's training manual. Hospital will be no different than any other hospital in our place. Well, they should know what they're doing, and you can ask them that because your mum needs to have the right care and treatment. Number 4, you are saying, instead of a picture of the ventilator screen, how about I ask for a printout of all settings since the start? If there is something else you want to know, let's see what they're doing or not doing at resting periods and during their trial periods. I would definitely like to see the picture itself because I'd like to see your mum's breathing volume, effort rate, and every important detail that is currently registered in the monitor of the ventilator with the current ventilator settings she's on. And normally that is not being documented in the report. If you could provide me with a printout of all settings, I would also accept that. One important thing as well is the result of the recent arterial blood gas or any other most recent blood gases. Picture of the bedside cardiopulmonary monitor and any other machines available at the bedside would be important as well. Hi Patrick, attaches the handwritten information about Mum's latest lab and x-ray. I will attempt to download the pictures I took. The hospital has informed me they intend to remove Mum's breathing tube and disconnect her from the ventilator to die, even though she's alert and awake and can communicate. Hey, hopefully I can get a court injunction. Kind regards from Bong. Hi Bong, thank you Bong for the lab results as per your email. I'm paraphrasing again. The hospital has informed me they intend to remove Mum's breathing tube and disconnect her from the ventilator to die, even though she is alert and awake and can communicate. Hopefully I can get a court injunction. I'm shocked just reading that. Did they tell they intend to remove the breathing tube for her to die? That is murder. They should safely remove the breathing tube and disconnect her to the ventilator by all means. We are dealing with lives here. I believe you can have a court injunction, or you yourself can make it stop. For example, refusal of treatment procedure if your mum is not extubatable yet. Important parameters need to be met. Stable vital signs, stable blood gas results, good chest x-rays, fully awake, stable spontaneous breathing effort. If she fails to meet any of those, then she's not ready for extubation, and she might take some time still to achieve that, but she can achieve that given enough time. You should get a court injunction, and we have seen families in intensive care going to the court even without a lawyer or an attorney achieving that, because I can't stress this enough. This is simply murder if they just remove your mum from the ventilator without your consent as the medical power of attorney. I will wait for your update and any additional clinical info you may provide. From Bong. Hi Patrick, thank you so much for your concern. The hospital will base its claim to the court upon their doctor's expertise and their ethics committee, whom I spoke before yesterday. Those presentations were verbal, where where those representing the hospital made inaccurate and misleading claims. Their notice letter was equally inaccurate and was based upon irrelevant issues. As amateur as their presentation and notice were, I have nothing to confront their claims with, just vague promises that something will be forthcoming that lays out proper medical treatment. I realize now that hospital does not have a protocol to properly wean someone like my mum off a ventilator because it can take weeks, so they mislead patients and force them off to either die or get a tracheostomy and move to long-term care facilities. This is why I see their respiratory therapists doing whatever they like with no plans. The hospital will be no different than any other hospitals in our place and in how they treat patients on ventilation. Either the patient is strong enough to extract themselves from the ventilator when off sedation, or they are thrown out with no meaningful treatment. From Bong. Hi Bong, thank you for the update. I am again paraphrasing here. I realize now that hospitals don't have a protocol to properly wean someone like my mum off a ventilator because it can take weeks, so they mislead patients and force them off to either die or get a tracheostomy and move to a long-term care facility. This is why I see their respiratory therapists doing whatever they like with no plans. Bong, ventilator weaning differs from every patient. Yes, the hospital may have a protocol, but they don't follow that as what most ICUs do. It's a case-to-case basis. We see that all the time, forcing families to sign papers for their loved ones to die, or just push them out to LTAC or long-term care facilities. You have to learn how to manage the intensive care team and not them managing you. Most families in intensive care feel completely intimidated and helpless. You should be able to know what questions you need to ask. And we, as your professional consulting and advocacy service here at the intensive care hotline, we can help you very quickly to make informed decisions, get peace of mind, control, power and influence during those situations. What you need to do now is to let them know that you are all for making your mum to live and do whatever is possible for her recovery. We've done advocacy and consultancy for many years now, and we've seen hundreds of critically ill patients recover and go home in stable conditions, and we're hoping we can do the same for your mum as well. Thank you kindly from Patrick, and the one-on-one consulting session will continue in next week's episode. So, how can you become the best advocate for your critically ill loved one? How can you make informed decisions, get peace of mind, control, power and influence quickly whilst your loved one is critically ill in intensive care? You will get to that all-important feeling of making informed decisions, have peace of mind, control, power and influence when you download your free Instant Impact Report now by entering your email below. In your free Instant Impact Report, you will learn quickly how to make informed decisions, get peace of mind, real power and real control, and how you can influence decision-making fast whilst your loved one is critically ill in intensive care. Your free Instant Impact Report gives you in-depth insight that you must know whilst your loved one is critically ill or is even dying in intensive care. Sign up and download your free Instant Impact Report now by entering your email below. In your free Instant Impact Report, you will learn how to speak the secret intensive care language so that the doctors and the nurses know straight away that you are an insider and that you know and understand what's really happening in intensive care. In your free report, you will also discover how to ask the doctors and the nurses the right questions. Discover the many competing interests in intensive care and how your critically ill loved one's treatment may depend on those competing interests. How to eliminate fear, frustration, stress, struggle, and vulnerability even if your loved one is dying. You will get 5 mind-blowing tips and strategies helping you to get on the right path to making informed decisions, get peace of mind, control, power and influence in your situation. You will get real-world examples that you can easily adapt to your and your critically ill loved one's situation. how to stop being intimidated by the intensive care team and how you will be seen as equals. You will get crucial behind the scenes insight so that you know and understand what is really happening in intensive care and how you need to manage doctors and nurses in intensive care, and it's not what you think. Thank you for tuning into this week's Your Questions Answered episode, and I'll see you again next week in another update. Make sure you also have a look at our blog section for more tips and strategies, or simply send me an email to support@intensivecarehotline.com with your questions. Also, have a look at our membership site, intensivecaresupport.org, for families of critically ill patients in intensive care. You can also call me. Find phone numbers on the top of our website. Have a look also at our ebook section, and you can also get one-on-one consulting with me over the phone, via Skype, via Zoom, and via email by clicking on the relevant tabs on the top of the website. Thanks for watching. This is Patrick Hutzel from intensivecarehotline.com, and I'll talk to you in a few days.